So it's very important to select the right surgeons and to form a relationship with the dentist that you trust. I am happy and privileged to be part of the International Dental Implant Association. It is awarded to those who have met the requirements, meaning you have to place a certain amount of implants and document the number of cases that we've done successfully. And also we keep up with our education. So just kind of a little scope of my training is that I've been trained down in Miami with Dr. Arun Garg, and he's pretty well known in the implant world. So I've seen a lot and I've done a lot, and I'm proud to be a fellow and to maintain my fellowship with the International Dental Implant Association. And we've also have a very high level of success in terms of implants. Probably about 98 plus 99% chance of success in terms of the implant process from start to finish. So in terms of a dental implant, it's actually less painful than having a tooth extracted. Myself being a recipient of a dental implant, I have one in my upper right, so I've been through the process myself as a patient. Usually it's very minimal. When we place the implant, we use plenty of irrigation in terms of fluids, and we take our time. So when we make the space for the implant, it's actually a very slow and boring process, but what that translates to is a very easy healing process, meaning you'll have maybe some slight discomfort around the gums, maybe slight soreness, but nothing that some over-the-counter pain medications would typically be able to handle, and sometimes not even at all. You know, now that we do that all in one office, I'm the only person. It's really it's really perfected to an art, and I think that's where my experience comes in. You know, doing a lot of cases and taking my time to restore these things to where it's not only functional, but it's going to be aesthetic and it's going to be beautiful. And hopefully you won't even notice. Nobody would notice you have an implant. They just tell you have nice teeth instead of looking at your teeth and say nice implant. I don't want anyone to say that. I want them to say you have a beautiful smile, you have nice teeth. All right. So our practice, what distinguishes us from other practices, is that I have a lot of experience in placing implants and restoring them. But one of the biggest things, we use the patient's blood as part of the procedure, and we actually will get a membrane and also some growth factors out of the blood called PRP, which is called platelet-rich plasma, and we condense that into a graft material and enhances the healing phase. Another big thing that is different in our office is I place the implants from start to finish, and so since I'm the surgeon and I'm also restoring it tends to translate better. The process is much smoother. You understand things from a perspective of continuity, and it's going to be done right because I'm placing the implants and I'm also restoring it. You don't have to go multiple places. You don't have to see different people for different things. It's just one person taking care of the process. So the pricing of a dental implant has gone down significantly just because there's so much more availability these days and much more demand. So when I had my dental implant, my own jaw, it cost a lot because I had to see a specialist to place the implant after it was taken out and grafted, and so it took a lot longer. It took about 6 to 9 months for the whole process to occur, and then having seeing a specialist, of course, it cost more money because I had to see a different doctor, and then I had to have the exam and the whole thing over and over again. But now, since we do it in office and with me doing the whole procedure from start to finish, it's probably going to be maybe like a half or maybe a third of what typically would be the price for an implant. And we do it more in a package, so we don't nickel and dime our patients. Obviously, if they need an implant, we give them, here's the package deal, here's what it is for the implant placement, for the abutment, for the crown. It's all there, including the surgeries. So if something happens during the surgery, if there's a part that needs to be ordered, it's all covered and that's all in one package. So that's kind of how we do it in our office, and we don't really have anything hidden in terms of is there anything extra. I mean, that's all it is. That's our price, and it includes everything. So if you need an implant, most likely you're going to be missing a tooth, or you maybe had an accident and a tooth got knocked out, or when you were younger, you know, you might have not developed a tooth from childbirth, you know, and you never had an adult tooth in that place. And so the process of a dental implant, of course, is that if it's an infected tooth, we've got to remove it and preserve that socket. When we take out a tooth, there's a hole there, obviously, and we need to preserve that bone, allow it to regenerate through a procedure called socket preservation. Sometimes that involves some bone grafted into the area. So once it's healed up and once you have a space, then we need to place an implant in there. A dental implant is made out of titanium, and of course the material we use is a very high level of commercially available and medical grade titanium through a company called Neodent. I'm very happy to be working with. But kind of the model right here, we would be placing the implant into the jaw, okay? And it sounds kind of scary, but it really is not, because you'll be very numb, and it's kind of a very light process in terms of preparing the space for the implant. And the implant is basically a very well designed titanium screw, basically, although it is probably unlike anything you will find at the Lowe's and Home Depot, but in all intents and purposes, it is a screw configuration, and it's been developed for many years, and has come to this design right here. We would place the implant into the bone, okay? Once the implant is into the bone will osseointegrate around the implant, so it will actually grow and uptake the implant. So it is a love relationship, basically. So the bone grows around the implant over a course of about three months, okay? And during that time, the implant is super stable into the bone. And once it's healed up and what we call also integrated into the bone, then we start to restore it or make the top part. This is the part that connects the implant out into the outside world, called an abutment. And we would basically engage that, and I'm going to take this one out of the model, but usually this implant doesn't come out after 3 months. If it does, there's something going on there, but usually it doesn't. Okay, and so we would attach this, and there's an internal screw that will allow this to be connected together. And then we would make a crown that will basically go over the abutment, and it will be cemented in it permanently. Therefore restoring your tooth one-to-one. It's self-supporting, it's flossable just like a normal tooth, it's brushable like a normal tooth, but you won't ever have pain because there's no more nerves into this tooth, and they cannot get any decay around it at all, unlike a natural tooth. So it does survive, seems to be a lot longer than a normal tooth, in fact. But you do need to keep it clean and keep the bone healthy around the dental implants. So that's kind of the process there, and this is on a bigger model on a jaw right here. You can see where the implant is placed into the bone. If you can see through the bone, that's what you would see there. And then a crown that goes over it is similar to this. Sometimes it can, the abutment, the top part, and the crown is one piece, and it can be placed in at the same time, but most of the time it's going to be two separate pieces, where you have the abutment and then the crown goes on top, it's cemented in there, and there you have it. You're all set. You can eat, you can brush, you can floss just like a normal tooth, and obviously you can smile without having your teeth falling out or anything like that, or have a missing space in the front. So all right, that's kind of the process right there.